Hello, everyone. Welcome to what today is the Jeff and Jeff Show. My name is Jeff Simmons, and I'm a multi-time auto racing champion, a four-time Indianapolis 500 competitor, and I'm currently finishing my doctorate in psychology. I'm a founding member of the Sport and Performance Psychology Club at the California School of Professional Psychology at Alliant International University in San Diego. And I'm joined today by Dr. Jeff Jones. Dr. Jones is a licensed clinical psychologist, sports psychologist, and a certified mental performance consultant through the Association of Applied Sports Psychology. He works with individuals, couples, and families in his private practice in Solana Beach, California. And for the last 30 years, Dr. Jones has primarily worked with high school, college, and professional athletes, as well as Olympians from a variety of different sports. These athletes have ranged in age from preteens to their mid-40s. Dr. Jones has graciously agreed to join me today to offer a brief presentation of useful skills and advice to athletes everywhere. I've had the honor and privilege of consulting with Dr. Jones and learning from his vast knowledge and experience. And I'm sure you'll see today why he has been so sought after and successful working with athletes and helping them achieve their full potential. Welcome and thank you for joining us today, Dr. Jones. And before we get to the sports psychology advice, perhaps you can share with us just what got you into this work?
Well, thank you, Jeff. Appreciate you having me here today. My interest in sports psychology really started back in high school when over summer football training camp, our coach introduced us to a number of things I realized later were mental skills, things like relaxation training, guided imagery, and yoga. We just called it stretching, but it was essentially yoga. And this was all during my senior year. We had a very successful undefeated season, and I think that those were sort of the critical mental skills that helped us be successful. I took my first sports psychology class at UCSD in my undergraduate and applied those lessons to my play as an intercollegiate rugby player. My dream to play for the national rugby team was cut short by an ACL injury shortly after I graduated from college. But to facilitate my reconstructive knee surgery, I utilized goal setting and positive imagery in my physical rehabilitation. My knee injury served actually as a catalyst for starting my graduate studies in clinical and sports psychology at the California School of Professional Psychology in San Diego. And my doctoral dissertation was in the area of behavioral coaching as applied to beginners and novice volleyball players. After completing my PhD, I joined the staff of the University of San Diego Counseling Center and was fortunate to work with a variety of intercollegiate Division I teams and individual athletes. I continued my sports psychology consulting work when I joined UCSD Counseling and Psychological Services staff. In the last 7 years, I've worked with USD's athletic scholar athletes and coaches from a variety of sports, such as softball, basketball, tennis, swimmers, volleyball, soccer, and all those competing at Division I level. Since 1997, I've been a member of the Association for Applied Sports Psychology, or ASP, and the American Psychological Association's Division 47 Exercise and Sports Psychology, and a member of the USOC's Sports Psychology Registry.
Interesting. Thanks for that. I didn't know some of your history, particularly about the knee injury that ended your rugby ambitions prematurely and ultimately helped propel you into your work as a sports psychologist. It got me thinking about how athletes, myself included, often reach the end of our careers before we hoped or expected, and that it's better to have more tools in the toolbox or clubs in our bags, so to speak, to draw on when we need to meet a challenge. With that being said, what useful advice or skill do you want to offer our athletes who are listening today?
Well, Jeff, as I thought about the various tools I try to equip athletes in, I like the metaphor of a golf bag and having different tools in your bag, being prepared for different situations. And the number one skill that I've recommended, and it's usually one I introduce in my first session with an athlete, is diaphragmatic breathing, or more maybe commonly called belly breathing. And this is really about training your physiology to relax in the presence of performance pressure or performance anxiety. I really see this as the cornerstone to a number of mental skills. And so it's important to sort of build this skill so that you can utilize it in a variety of ways. Some of those uses are to counteract situational anxiety. Oftentimes I'm working with athletes, baseball players, softball players, and one of the situations where they experience anxiety is at the plate, facing the pitcher. Or a basketball player at the free throw line, they have a moment to sort of catch their breath and really refocus. Soccer players taking a penalty kick, tennis, every time someone serves, they have a moment there to utilize their breath to help them relax and focus. And even swimmers at the start of their race to take a moment to sort of pause and refocus. I've also utilized this to prep mentally prior to a match or a game, to sort of mentally rehearse what you'd like to perform, how you'd like to perform, utilizing imagery or visualization techniques. I've also used this breathing technique to practice progressive muscle relaxation, or to utilize it during stretching to sort of help enhance your stretch, to manage sometimes physical pain, to cope with physical discomfort during exertion. And it can also be used as a tool for refocusing or recovering from an error, mental error. So those are a lot of the uses I use diaphragmatic breathing, and I just want to talk briefly about what exactly is diaphragmatic breathing. Some people have, as again, maybe heard it as belly breathing, but it's one of the quickest, most effective techniques for being able to put yourself into an optimal performance zone. It can be used in practice, as I said, as part of your it could be used part of your pre-pitch routine for a pitcher who wants to sort of focus on their selection of pitch. It could be the batter, as I said, preparing for on the on-deck circle, using a couple deep breaths to sort of get themselves grounded, anticipating they're going to step into the batter's box. Or it can be used actually to reset at any point. Ideally, when you're using diaphragmatic breathing, you want your breath rate to be somewhere between 5 to 7 breaths per minute. That may vary, of course, depending on what your lung capacity is and how slow and deep you may breathe. But ideally, we want you either lying down on your back in a comfortable position or seated in a comfortable position with both feet placed firmly on the ground. And I usually ask when I'm instructing someone in this for the first time to place one hand on their chest, and the other one I have, which may be out of the view here, is down on my stomach. And I'm going to turn sideways here to try to demonstrate the difference in when I take this breath and what you might experience. So as I turn sideways to help you see more clearly, as I take a deep breath in, I'm actually pushing my stomach out, which feels a little awkward at first, but my chest is not moving. And then as I exhale, my stomach sort of reclines. It's more pronounced when you're actually laying down. As I take another deep breath in, my stomach expands. And as I exhale, it collapses again. So that's essentially, and the hand on the chest is just to help make sure I'm not doing chest breathing, which oftentimes I tell athletes, take a deep breath. They take a deep breath in and they sort of lift their shoulders. Particularly guys, we want to sort of flex our chest, and that's not actually diaphragmatic breathing. It's great for exercising your trapezius and flexing your muscles up here, but it doesn't really work in terms of maximizing your oxygen intake. And that's really what this diaphragmatic breathing is to help maximize your lung capacity by drawing the diaphragm, which is really a sort of a muscle membrane that separates your chest from your internal organs. And as you draw that down, it actually expands the capacity of your chest to take in more oxygen. So now to the critical part. Personally, I like to inhale through my nose, and then as I'm exhaling, sort of pursing my lips like I'm blowing up a little balloon, and slowly blowing out that air, sort of drawing that breath out. So as I take a breath in, sometimes I'll use a count of 4 or 5, and I'll use my hand to sort of symbolize this because you can't see my stomach, but I'll go 1, 2, 3, 4, hold it for 1, 2, count of 1 or 2, and then a longer exhale. 1, 2, 3, 4, 5, 6, 7, maybe as much as 8, and then repeat. Now, a lot of people find the counting as a way helpful to sort of structure their breathing at first until they get into sort of a natural rhythm. But you can use a variety of other techniques. Some people have watches that will have a breathing diagram on their Apple Watch that help assist with this breathing. Other people may think of another count, maybe just a rhythm or maybe a beat if they have a song in their head. And they sort of take a count up to a certain number of beats, and then they hold it for another beat or two, and then they exhale to a longer set of beats. So that's the essence of the diaphragmatic breathing, and it sounds very simple. It's the simplest thing I teach athletes on the first meeting, and oftentimes they will come back and say, wow, that was really helpful. I had one professional baseball player years ago, played for the Padres, and he was having anxiety at the plate, stepping up to the big leagues from the minors. And he was getting, his mind was racing, and he wasn't really able to focus on the things he needed to. So giving him this breathing technique helped him settle into the batter's box, refocus on the pitcher, trying to pick up the appropriate cues to help him be more successful. And it was really the simplest thing I could teach him, and he came back and thought it was, amazing. So I don't always get that response, but oftentimes individuals feel like, their eyes have been opened to a magnificent or a magical sort of trick to sort of help regulate their physiology, which feels like it's oftentimes something that's out of their control. But the breathing actually is one way to help slow down your heart rate, help probably decrease your blood pressure, help sort of synchronize your body to reach that state of relaxed concentration, or the state approximating your peak performance. And once you get comfortable with the diaphragmatic breathing, you can try other sort of relaxation techniques. I mentioned progressive muscle relaxation. We use the breathing as the cornerstone, and it's simply a technique of tensing and relaxing muscles, starting at maybe the feet, moving up to the calves, moving up to the quads and hamstrings. And with each breath that you're taking, you're contracting that muscle group, and as you exhale and relax that muscle, it coincides. And so that's an example of using the breathing as a cornerstone to that specific relaxation technique. So let me pause there and see what questions you might have, Jeff.
Yeah, I think that's a great foundational skill that takes advantage of the mind-body connection that you're talking about there, both the diaphragmatic breathing and then adding in some of the other things like progressive muscle relaxation. For people that are just trying diaphragmatic breathing maybe for the first time or are fairly inexperienced with it, how long would you recommend that they practice it, at a time, and maybe how many times a day or a week?
Great question. Yeah, usually what I'll suggest is just taking maybe as few as 4 or 5 minutes to take a break. And this can be a great way to sort of build a break into your day. Now, you may not always be able to find sort of a quiet place to, sit down or lay down. At a minimum, I'll suggest individuals try this as they're going to sleep at night. And it's particularly helpful, actually, if anyone has sleep difficulties. For my clients who have sleep disruption, I'll recommend this breathing technique as a way to help them try to quiet their mind and drift back to sleep. And oftentimes with athletes, since they've been training physically, they may not even get 4 or 5 minutes of practice. They may fall asleep rather quickly. So if that's the case, I'll say, well, maybe some other time in your day you can do this. I've also recommended, I get stopped at a traffic light, it turns red, and I might be feeling anxious, like, oh, I got to get going. And I say, oh, wait, here's my opportunity to practice my breathing. And I don't close my eyes. If you're doing this at home, obviously you can choose to close your eyes, and that might enhance your ability to sort of focus inward. But if I'm in my car, I'll just take a moment to practice my breathing, and it gets reinforced. And it's conditioning your body to respond to certain cues, whether it's placing your hand on your stomach, whether it's just feeling your stomach pushing out. We can also pair this with auditory sounds. You can pair this with something like a smell. I use like a chapstick that can be paired with the breathing, the relaxation. So if I put this on my lips as I'm doing the exercise, I have that scent, and I can then utilize this as a cue in moments to relax in that moment. So a player could ideally, put on his chapstick before stepping into the on-deck circle. That might enhance their relaxation response. It's a cue that helps them go, oh, it's relaxation time. So yeah, there's multiple places that you can practice it throughout your day. It doesn't need to take a lot of time. Some people will take this and incorporate in guided imagery and do a more enhanced, lengthier relaxation exercise, maybe listening to sounds of the ocean or a babbling brook. We've got lots of apps these days that offer sort of natural sounds that can enhance a relaxation response, or even some that offer you guided relaxation exercises where it typically starts with your breathing, and then they may guide you on an imagery of, floating down a river or sitting at a beach, any number of things that can enhance your practice of relaxation training.
Well, that's great advice. I appreciate that. I think that can help really a diverse range of athletes from different disciplines and skill levels, as well as just anybody who can use that as a relaxation technique. And your expertise and experience has been a true asset to so many in the sporting community. And for those athletes that are interested in sports psychology and mental skills training, I encourage you to contact Dr. Jones for a consultation, find out how you can work together, get an edge on your competition, and reach your fullest potential. His contact info will be on your screen at the end of the video. And my sincerest thanks again for joining us today, Dr. Jones.
Thank you, Jeff. It's been a real pleasure.
Thanks to everybody for watching. Like and share this video and our social media pages so that we can continue bringing you the content and educational material that you want. Thanks so much.